Ever wondered what you would do if someone around you started choking? It's an alarming thought, isn't it? Yet, choking is a common and potentially life-threatening situation we could encounter anywhere at any time. Whether at a family dinner, in the workplace, or even walking down the street, the ability to respond effectively to such emergencies can be the difference between life and death. Today, we aim to equip you with the knowledge to handle such emergencies. Step 1 in any emergency is to assess the situation. In a choking incident, you need to look for telltale signs. Is the person coughing? Are they having difficulty speaking? Has their skin color started to change? These could indicate that their airway is blocked. Now, it's crucial to determine whether the blockage is partial or complete. This can significantly influence your next steps. Remember, understanding the severity of the situation is the first step in providing effective help. Once you've assessed the situation, it's time to act. If the person is coughing and can talk, it's likely a partial blockage. Encourage them to continue coughing. It's the body's natural way of dislodging the obstruction. Maintain a calm demeanor to help keep the person relaxed. However, if the blockage seems more serious, you need to step in. The backslap technique can be effective in these situations. Stand to the side and slightly behind the person. Support their chest with one hand and lean them forward. With the heel of your other hand, deliver up to 5 sharp blows between their shoulder blades. Make sure these are firm and delivered with an upwards motion. This may seem a little harsh, but it's necessary to dislodge the obstruction. If the backslap technique doesn't work, you'll need to move on to abdominal thrusts, which we'll cover in the next scene. Remember, quick and appropriate response can make all the difference. When breathing becomes impossible, it's time for the Heimlich Maneuver. This technique, named after Dr. Henry Heimlich, is designed to clear obstructions from the airway swiftly and effectively. First, position yourself behind the person who is choking. Reach around their waist and locate the navel. This is your landmark. Now make a fist with one hand and place the thumb side against the middle of the person's abdomen, just above the navel. Grasp your fist with your other hand. Next, you'll need to apply quick upward thrusts. Imagine you're trying to lift the person off their feet. These thrusts should be firm and forceful, but be careful not to apply too much pressure to avoid causing injury. Continue these thrusts until the blockage is expelled or the person becomes unconscious. If unconsciousness occurs, immediately call for medical help and begin CPR. The Heimlich Maneuver is a life-saving technique when used correctly. But what if the person choking is unconscious, a child, a larger individual, or even a pet? Well, let's dive into some special situations. For unconscious victims, the approach is different. Carefully lay them down, clear their airway with a finger sweep, and if necessary, perform CPR. Remember, CPR is a lifesaver, but it's also a skill that requires proper training. Now let's talk about larger individuals, such as pregnant women or obese persons. The Heimlich Maneuver needs to be adjusted for them. Instead of placing your hands around the navel, you should place them higher up on the abdomen, essentially at the base of the breastbone. This adjustment ensures the safety of the individual and increases the effectiveness of the maneuver. When it comes to children and infants, it's a whole different ballgame. Specialized techniques are required for their safety. For children over 1, use the Heimlich Maneuver, but with gentler force. For infants under 1, use a combination of back blows and chest thrusts. Remember, their bodies are fragile, so caution is paramount. And finally, our furry friends. In case of a choking pet, assess the situation carefully. Try to remove the obstruction if you can see it, and if safe to do so. Delivering back blows might also be necessary. And of course, seek immediate veterinary assistance. Every situation is unique, and understanding how to adjust your response is crucial. After all, knowledge is power, and in these situations, it can be the difference between life and death. Being informed and prepared can save lives. In the face of a choking emergency, every second counts, and your knowledge could be the difference between life and death. Let's ensure that everyone has access to this vital information. Take a moment to share this video with your friends, family, and co-workers. Help us help others. Share this video and spread the message. And now our question for you. Do you feel more prepared now to handle a choking emergency? Let us know in the comments. Thanks for watching.